Hi friends, this is Dr. Abdequaem Chimthanawala. Today I'll discuss one of the very important remedies, a remedy used for urinary complaints and bladder complaints, and I'll discuss today whatever symptoms clinically I have seen in my practice and I have got good results. The remedy which I am talking about is Petroselinum. Now Petroselinum, if you have seen in your Mater Medica or in your repertory, it has a lot of symptoms related to urethra and the bladder. Now I'll discuss some of the very important symptoms clinically verified in my practice, and that has given me a lot of results in this type of complaint or ऐसे symptom रहे तो. First of all, discharge. The discharge from the urethra is acrid and corrosive. This is a very important symptom of Petroselinum. Discharge are very acrid and corrosive. Normally, in these complaints, we normally prescribe remedies which are more chronic, that is urgentum nitricum or mercor or natrium. But Petroselinum is also a very important remedy when the discharge are very acrid and corrosive. As you go further, in Petroselinum, the discharges from the urethra is albuminous. Now this is a very important remedy for whether when the urethral discharge is albuminous in comparison with canthus and nitric acid. These three remedies are the very important remedies. Of course, most of the cases where the discharge from the urethra is albuminous, these three remedies should cover. The first, I give importance to Petroselinum. Sometimes, don't always look for the acridity and the albuminous discharge. Sometimes in Petroselinum, the discharge is clear and transparent. It is a very clear and transparent, or it is also called as colorless discharge. There is no color in the discharge. And when the discharge is absolutely colorless, with Petroselinum, one remedy should compare, that is natriuria and cantharis. Now, if you see the Mater Medica of Petroselinum in relation to urethral complaints, you will find these remedies like cantharis or nitric acid and natrium coming very close to Petroselinum. That's why this remedy sometimes, if it is indicated, also not given because of the comparative chronic remedies which come with this. Again, the discharge sometimes are milky from the urethra in Petroselinum, and especially if the discharge is milky after urination, then you must think about Petroselinum. In comparison, compare it with natrium, compare it with copaiba or lachesis. Again, natrium comes with Petroselinum, and the discharge is normally very chronic. The patient comes to you with some other symptoms, and when you ask symptoms of the urethra, he says, now this has been so chronic that I have white discharge after urination from the urethra, and then you find out the remedy is Petroselinum. So chronic discharges, chronic white discharge from the urethra after urination, think about Petroselinum or lachesis or sepia, which are again very much indicated in these type of complaints. Now there are some sensations where in the urethra, as in homeopathy it is so important to understand the sensation in the urethra. The patient feels a dropping from sensation, something is dropping from the urethra while passing. So this is a very important symptom. While passing urine, there is sensation that something is dropping from the urethra. Or you can say that there is one symptom and there is formication in the urethra. There is crawling during urination. Now this is again a very, very important symptom, because formication or crawling during urination in the urethra, there are only three remedies which I have used in my practice in most of the cases, and that has given me very good results. Petroselinum, compare that with phosphoric acid and ignitia ambra. These three remedies have a very, very interesting symptom, that is formication or crawling during urination. And this symptom the patient will tell you very, very precisely and very, very clearly in your case taking. And of course, there is sometimes there is biting pain in the urethra, and the patient basically has a lot of pain and biting pain during urination. So pain, formication, the sensation, these are also very important. And there is one symptom which is very, very important in Petroselinum, where your anatomy has to be very good. That it is said that there is a cutting pain in the urethra, especially at the fossa navicularis, especially after urination. Now there are only two remedies which are very important. The first important remedy and the most important remedy is Petroselinum, and the second is definitely Thuja. So some anatomy, if you remember this fossa navicularis, please go home and check in your books of anatomy, and you will understand how Petroselinum works in this complaints. As you go further, then see there are a lot of other symptoms of Petroselinum, but these symptoms basically I verified in my practice and have got a good results. Now, one symptom which is very close in Petroselinum, and you will be confused that I have seen lots persons giving some other remedies, but it is said that appetite is increased in general in Petroselinum, but vanishing on attempt to eat. इन लिटिल हम बोल सकते हैं कि भाई पेशेंट को भूख बहुत लग रही है, बट जब खाना खाना शुरू करते हैं तो एपेटाइट चली जाती है. और जब भी ये सिम्टम, whenever we find this symptom, we normally start thinking about lycopodium, that few mouthfuls fills up the room. But this is basically vanishing on attempting to eat. Attempting, खाना खाने के टाइम पे पहले ही एपेटाइट चली जाती है. Very important remedy Petroselinum, and one more important remedy that is very, very important, and that is Cilicia. So my dear friends, this is something very clinical, verified symptom in my practice which I have seen in Petroselinum. So if you like this video, do share and subscribe. Thank you.